Coronavirus cases are breaking records nationally, and we're seeing the effects here in Alabama. Over 80 deaths were documented yesterday. Our Sydney Stallworth met with experts at Huntsville Hospital to hear what they're seeing and if they're preparing for a potential surge.
In the last week or so, we are seeing the cases related to COVID-19 infection are going up, and people should worry about and take precaution.
And the Huntsville Hospital system is prepping for the worst.
And we have a policy in place, an emergency plan that has been in place since April.
With cases on the rise, I'm told the hospital is facing staffing issues.
Currently, we are going through shortage. So in the coming month, if we continue to see the same number of cases, or we continue to have healthcare worker going on quarantine, or they acquire themselves COVID-19, yes, there is a concern that we may expect to see shortage.
And in terms of PPE?
For now, we are good. But we don't know how much of a number go up and whether we'll have adequate supplies at that time or not. But I would say that right now we have enough.
North Dakota has made headlines after allowing healthcare workers to remain on the job after testing positive for COVID-19. This after hospitals reached 100% capacity. I asked if this is something that could happen in Huntsville hospital systems if they face an extreme staffing shortage.
Yes, if it comes to that, then taking care of patient is the first priority. And if the healthcare worker is positive and they're only getting exposed or being exposed to the people who are positive, then it doesn't make a difference between them as long as we are taking care of the patients.
Dr. Siddiqui tells me that with the rising coronavirus cases and the holidays right around the corner, this could be a recipe for disaster. She's encouraging you not to mix groups during the holidays and to consider virtual celebrations. Putting the Valley first, Sydney Stallworth, WZDX News.